Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the presentation on managing vasovagal syncope in dental settings. This condition is important to understand as it is the most common cause of temporary loss of consciousness in dental office. Vasovagal syncope typically occurs due to a series of cardiovascular events triggered by emotional stress associated with dental care. Vasovagal syncope starts with a stress-induced increase in catecholamines. These catecholamines lead to reflexive actions that decrease peripheral vascular resistance. This process involves the dilation of blood vessels and a decrease in blood pressure. For details, watch our previous video about pathophysiology of vasovagal syncope. The decrease in vascular resistance causes bradycardia, a slowing of the heart rate mediated by the vagus nerve. Patients might experience sweating and a feeling of warmth. Blood starts pooling in the peripheral areas of the body, which drops arterial blood pressure further. As blood pressure drops, cerebral blood flow decreases, leading to dizziness and weakness. Patients may also complain of nausea and palpitations. If the blood pressure drops below the level needed to maintain consciousness, syncope occurs. If cerebral ischemia develops slowly, the patient may experience seizures before losing consciousness. Placing the patient in a horizontal position with the feet elevated, that position is known as a Trendelenburg. Then it can quickly end the syncopal episode and any accompanying seizures. The Trendelenburg position is a surgical position where the individual lies supine and are flat on their back, their feet raised higher than their head. It was named after the German surgeon who originally used this position to improve surgical access to the abdominal and pelvic organs by taking advantage of the gravity. For many years, the Trendelenburg position was used in the treatment of hypovolemic shock to increase cardiac output and circulation to the heart, as well as to improve blood flow to the vital organs. Although it is mentioned in your textbook, and despite its historical use, the Trendelenburg position is no longer recommended for treating hypovolemic shock, especially in individuals with pre-existing cardiopulmonary disorders. This position can cause adverse effects, including increased pressure on the lungs and heart, which can be harmful in these patients. So in case of syncope, lay the patient flat with the legs elevated to improve venous return and cerebral perfusion. Ensure the patient's airway is open. Monitor vital signs closely, administer oxygen if necessary, and identify and treat the underlying cause of syncope to prevent recurrence. Now, how will you prevent syncope in your clinical practice? Preventing vasovagal syncope involves proper patient preparation. For highly anxious patients, use anxiety reduction protocols and, if necessary, anxiolytic drugs before treatment. Dental care should be provided while the patient is in a semi-supine or a fully supine position to minimize the risk of syncope. Educate patient about procedures to reduce anxiety, provide further comfort measures and a supportive environment to help patient feel at ease. Monitor patients for signs of distress and communicate effectively to address any concerns immediately. After regaining consciousness, the patient may experience pallor, nausea, and weakness for several minutes. It is important to monitor the patient closely and provide reassurance during this recovery phase. The patients recover within minutes. If signs of an approaching faint are observed, act quickly. Position the patient fully supine with legs elevated above the heart level. Applying a cool, moist towel to the forehead can also help in managing the episode. In some cases, the patient may hypoventilate and be slow to recover consciousness. Using aromatic ammonia can act as a respiratory stimulant to help speed up recovery. If consciousness does not return within a minute, consider alternative causes for the patient's condition. After recovery from fainting, the patient should rest in the office before being discharged. Make sure the patient gets home safely with someone. For future dental visits, use pre-operative sedation and other measures to reduce anxiety and prevent recurrence. Let's explain the management steps of syncope in clinical practice using a flow chart from your textbook. Note that many of the points already discussed will be repeated, but the students are advised to listen carefully. The prodrome, which is mentioned in the flow chart that refers to the early signs or symptoms indicating the onset of a disease or a condition before more specific symptoms occurs. In context of a syncopal episode, it might include symptoms like dizziness, nausea, or lightheadedness that occur before fainting. The fainting actually occurs in the syncopal episode. Then in syncope, there are two conditions. One is when the breathing may be absent or breathing may be present. So we will proceed in this way and explain this flow chart step by step. As we pointed out that in the prodrome stage, the patient may exhibit early signs like dizziness or feeling faint. First of all, stop all dental treatment to prevent any further risk. Next, position the patient in a supine posture with their legs raised above the level of the head to improve blood flow. Attempt to calm the patient to reduce anxiety and stress. Place a cool towel on the patient's forehead to help them feel more comfortable. Finally, monitor the patient's vital signs to ensure stability. During a syncopal episode, it is critical to act quickly and effectively. Immediately stop all dental treatment to avoid any potential harm to the patient. Position the patient in a supine posture with their legs raised to help improve blood flow. Check for breathing to ensure that the patient is still breathing normally. Now, when you will check the breathing and if the patient is not breathing, then start basic life support immediately. Have someone nearby call for medical assistance to ensure help is on the way. Consider other potential causes of syncope, such as hypoglycemia, cerebral vascular accident, or cardiac dysrhythmias to produce appropriate care. If the patient is breathing, take further steps to ensure their recovery. Crush an ammonia ampule under the patient's nose to help revive them and administer oxygen if necessary. Continue to monitor the patient's vital signs to ensure they remain stable. Arrange for the patient to be sent home safely, accompanying someone. Plan for anxiety control measures for future dental visits to help prevent recurrence. To conclude, recognizing and managing vasovagal syncope is crucial in a dental setting. Proper prevention, quick response during an incident, and careful post-incident care help keep patients safe and comfortable. Thank you. Wish you best of luck.